Nerve conductions and electromyography. This is very different than the EMGs. The reason being is because now we're looking at how fast a nerve can conduct electricity. A very different concept. So as we move through this material, understand that now we're not just looking at things like amplitude, we're not just looking at sound, but we want to see how fast we can get from point A to point B. So in looking at nerve conduction studies, basically what we're doing here is we want to evaluate both a motor nerve and a sensory nerve. We're going to look at the peripheral nerves obviously here, so just understand that. And what we're looking at specifically are recorded responses. Like I said earlier, we're looking at how fast we get from point A to point B. And there's four basic responses we're looking at: a compound motor action potential, a sensory nerve action potential, something called an F wave, which we'll get into later, and then something called an H reflex. So looking at nerve conduction studies, again, like I said, we're looking at the differences from getting to point A to point B. So this is a common reading you're going to find with a nerve conduction velocity study. So after the responses are recorded, then we're going to make some measurements. So big thing is, let's see how fast it moved, right? So that's what's going to be the velocity. The other thing is, let's see if there's any lag time or latency. We'll take a look at the amplitude again. We'll also take a look at something called the area, which is how wide that signal went. And then we're going to also look at something like a duration. Let's just look at the total time. So when we're looking at those things, what we have to remember is that we're only going to look at large diameter myelinated fibers here. And what nerve conduction studies are really good at is pinpointing location or severity of damage. For example, if we had a nerve that was actually cut. So looking at EMG study, what we're looking at here is obviously a needle that's inserted into muscle, and we're going to evaluate and record the electrical activity produced by that muscle. This type of diagnostic procedure allows for the detection of electrical potentials generated by muscle cells when these cells are neurologically activated. So basically what that is saying is, when I zap the muscle, something happens. That's exactly what an EMG study is. I insert a catalyst, I insert a stimulus, that being electric potential, and I want to see what happens when I make that electrical potential happen. So here's why we need to do nerve conduction and EMG testing. We want to look at neuropathy. Now that can be something very localized like carpal tunnel, tarsal tunnel. Sometimes somebody can have a fibular neuropathy. Sometimes someone can have like an ulnar neuropathy. I've seen that several times in my career. They can be for more generalized things like Guillain-Barré or diabetes. And then other more serious complications, things like myasthenia gravis, things like Lou Gehrig's disease or ALS. And there's a lot of other conditions that can benefit from NCS and EMG testing. So who does these? A lot of folks do. Physiatrists will do them, neurologists will do them. I worked at a physical medicine and rehab center, and the physical medicine and rehab doc did them. So there's a lot of folks that will do these. Physical therapists will do these. There's not many around the country that do. I will tell you that if you're looking for something different in your career and looking for something that is just a little different mode of practice, this is not a bad option for you. It does require continuing education. It does require certification. You got to sit for an exam. There's all those barriers. But if you're really looking for something different to do, this is not a bad place to start. Now, if you want to become board certified, then here are the criteria. So about 2,000 hours in the specialty area within a 3-year period of time. You got to do about 500 studies. And this is something that, take a look at your state laws. I know that in Florida, it was pretty hefty. I think you had to do 500 studies under a supervised physician or another practitioner that was certified. And then you have to take an ECS exam. And that is a clinical specialist exam, just like the OCS or GCS exams. But you would be able to put those letters ECS behind your name, and obviously be able to conduct EMG studies and NCV studies. This is a side note slide. Okay, so full transparency here. Obviously, just like with our physical exams, just like with the rest of diagnostic imaging, nerve conduction studies and EMGs are an extension of the physical exam. They do not replace the physical exam. So please don't think, oh, I can just do an EMG or NCS and really get the full idea. It's just like taking an x-ray on someone without knowing how they got hurt or what pain they're having. So we need to do all of our due diligence here. We need to be very good medical screeners. So here's the equipment we're going to use, and here is the flow chart for how that equipment works. If you notice, it looks a lot like those ultrasound machines. Okay, well, obviously we're just dealing with a little different scenario here. So read through this. I'm not going to read this one to you. Just understand how that pathway works. Understand how we get the reading and where that reading comes from. So looking at the actual stimulator, that has a little red arrow next to it in the picture. It's going to be electronically isolated. So basically what's going to happen is we're going to shoot in a monophasic square wave at the cathode, and it depolarizes the nerve. Remember, the nerve has a little bit of a negative polarization anyway. The current's going to be altered in 3 different ways. Either the intensity is going to go up, the duration is going to go up, or the rate's going to go up. So in looking at all this equipment, the best analogy I can make to something you guys have had so far is iontophoresis. A lot of this stuff looks like the stuff you're going to have with iontophoresis. Right? We're going to have a ground, we're going to have a active electrode, and then we're going to have a reference electrode or a dispersive electrode. So basically, the ground just serves as a 0 voltage reference point. Okay, that's just like a ground in all of your electrical outlets in your house or your apartment. The active electrode is going to be the one that sends in the big zap. The reference electrode is used for recording purposes. So in looking at this, I've always kind of said with nerve conduction studies, point A to point B, active electrodes my point A, reference electrodes my point B. In looking at amplifiers now, just understand that an amplifier is going to convert low voltage potential to a higher voltage copy. Okay, so there's a couple different types of amplifiers, and all that's going to do is really just do exactly what an amplifier does. It makes what is small big, just like the amplifiers that you would see, a rock band use. A filter is going to be necessary, and the reason is because we're going to have a lot of other noise. So really what we're trying to do here is filter out the signal and filter out the noise. So a filter is just going to work like an old style radio. Okay, so what we're trying to do is filter out all the static and get the signal that we really want out of these studies.